Morning.
I think I'm gonna stand here. Is that okay? So I can advance
Sure.
my slides? Sure. Okay, and can everybody hear me? I'm gonna project as loud as I can. I want to thank the organizers and sorority for inviting me to give a presentation. As you know, this is National Alzheimer's Awareness Month. So I'm so happy to see that you are very engaged in learning about this disease. I am, as you heard, a professor at Rush, and I've been there for a little bit over 15 years now. And I started off as, looking at Alzheimer's disease primarily in African Americans, but over time I've sort of expanded where now I look at chronic diseases of aging and with a particular focus on health disparities. And that's why I have this new center now looking at HIV and aging, because people are living longer and HIV is starting to look like Alzheimer's disease in some people. So there's a connection there. You're like, what is she doing that for? So what we do at the Rush Alzheimer's Disease Center is we focus on studies of prevention. Now, you might wonder, why is Alzheimer's disease in the news all the time now? Well, in the early 20th century, in the early 1900s, people didn't live much past age 50. There were things like tuberculosis, whooping cough, polio, those kinds of things that people got. I'm going to give you the history of this disease so that, we can come from when it started to 2015. It started with this person here. Her name was August D. She was 51 years old when she became a patient of Dr. Alois Alzheimer. He was a German psychiatrist. And she had profound memory loss and unfounded suspicions about her family and friends and other psychological problems that got worse. And this is a snippet from his notes about her case. He said, from time to time, she was completely delirious, seeming to have auditory hallucinations. When the doctor showed her some objects, she first gave the right name, but immediately forgot everything. In a writing test, she repeated syllables, omitted others. In her conversation, she used confused phrases. She did not remember the use of particular objects. This is very characteristic of what we see in patients with Alzheimer's disease. But at that time, she was only 51. It was 1906, right? People weren't living that long. So they thought it was a rare disease of middle age. But when she died, she died 5 years later after she had been in his care. And he looked at her brain under the microscope, and he saw these characteristic changes that we know are plaques and tangles. It was amyloid plaques and neurofibrillary tangles, which are just abnormal proteins in your brain. So he saw this buildup, and he thought that this was some rare disease. But now we know that the plaques and tangles is what we see in people with Alzheimer's disease. So that's what she had. And so now in 2015, after years and years of research, we know that Alzheimer's disease is a common and chronic disease, usually of older people. It's the most common cause of dementia, and it's characterized by slow onset and gradual progression of memory problems, followed by impairment in other thinking skills. Importantly, because we don't know what causes it, there is no cure. And we have medications, but all they can do is treat the symptoms. They do nothing to change the course of the disease, unfortunately. The most important part I want you to take away is that this is not a normal part of aging. For years, I've been working in the African American community for a long time, and people think that this is just a normal part of aging, that you're supposed to lose your memory as you get older. And that's simply not true. No. We get slower, we become less focused. Things happen as we get older, obviously, we kind of wear down with age, but you don't have to lose your memory. There are people in their 90s and 100s, sharp as a tack.
Amen.
Right? So we want to be like that. So we want to figure out what this disease is so that we can all be sharp as a tack when we're in our 80s, 90s, 100s. Right? Right. So, but let's make sure we understand the difference between dementia and Alzheimer's disease. So dementia, you can think of as just the umbrella term. It's a cluster of symptoms. Memory loss, judgment, impairment, reasoning problems. So it's a cluster of symptoms that are caused by different diseases. So like you might say you have a cough. The cough is a symptom, but something is causing the cough. So dementia is the same way. It's just symptoms of something, of memory problems. And there's different things that cause it. Alzheimer's disease is the biggest box here because it's the most common cause of dementia. But you can have dementia for vascular reasons, like if you have strokes. You can have it because you have Lewy body disease or Parkinson's disease or frontotemporal dementia. Then there's a number of other dementias that can be caused by reversible problems. So you can have an infection like pneumonia, or you could have depression. And usually when you treat those issues, the dementia goes away. But in these kinds of, like Alzheimer's, vascular, it doesn't go away. It's irreversible. Once you start having these diseases, the dementia is going to be progressive. Is everybody clear about dementia versus Alzheimer's disease? So if somebody says, Mom had dementia, what's the difference between dementia and Alzheimer's? What would you say?
Dementia is the bigger problem. We got to find out what's causing it.
Right. So they say Mom has dementia. You say what kind?
Right.
That should be your next,
Right.
And usually we probably say Alzheimer's because it's the most common kind.
Right.
But there are other types as well. So, this is Alzheimer's Awareness Month, so you should know the statistics around it. More than 5 million people have Alzheimer's, but that's probably an underestimation because we know that a large percentage of people never make it to the medical system to get a diagnosis. And that's particularly true for minority populations and other underserved populations. We don't go to the doctor for various reasons, and so we never get the diagnosis. So this is probably a low number. It's probably much, much higher. This is in the U.S. It's the 6th leading cause of death, and more than 15 million unpaid family and friend caregivers are involved with this disease. That's a lot of people, right? And so it's not only causing, this incalculable toll on the person who has it and their family, but also it's costing us billions. I think the latest estimate is like $283 billion to care for this disease. So, and it's going to get worse because our numbers are growing as a nation. The older population is growing quicker than any other population, and we're living longer. So we're going to see more. This is a really serious issue that we need more researchers and more money to be poured into this. Otherwise, it's going to bankrupt us. So what are the manifestations of Alzheimer's disease? Well, typically the first thing you see is cognitive impairment. So you have some problems with your memory, your language, your attention, visual spatial skills. But it also affects your affect. So you'll often see that people have depression when they get Alzheimer's disease. There's also behavioral disturbances. So people might become psychotic, have psychotic symptoms, or they have hallucinations and misperceptions, a lot of paranoia. Mom is, accusing me of stealing her money, or taking her jewelry or whatever it is. You might have a really calm person who's calm their whole life suddenly become aggressive and mean. And you're like, I don't know this person. Or they can go the other way. A really mean, nasty person can become nice. We're learning, more recently that it also affects your motor function. So people will have Parkinsonian signs. It'll affect how they walk and also how their muscles, myoclonus. We also see a lot of weight loss and even have seizures. So, this is a progressive disease that's going to get worse. It's going to start off with these little mild memory problems, and then eventually it affects every system in your body, and you become bedridden, and then you eventually die.
Jesus.
So it's a really awful disease. How many people know someone with Alzheimer's? Wow. Yeah. So I think, it affects, it's touching all of us. We can't say that this is just one population's disease anymore.
Are there different stages?
There are different stages that they've kind of broken it down into. First, we thought it was 3 stages. Now we've kind of made it more into 7 stages. But it doesn't really help if you know what the stage is. Really the important thing to know is that it's progressive. And as soon as you identify a problem, get to the doctor right away, because the medicines that are out there work best in the beginning. You know, so when you have mild symptoms. Yes.
I saw that the first patient was 51.
Uh-huh.
So at what age does it begin?
Yeah, it's a good question. I'm going to get into that in a minute, okay? So the Alzheimer's Association estimates that African Americans are about 2 times more likely than whites to have Alzheimer's disease. No surprise, right? Everything affects us more. But you know, this data is alarming because it's based on a couple of large studies that have been done. And I'm showing you here data from one of those studies out of New York, the study called YCAP. And it's a study of whites, African Americans, and Hispanics over the age of 65 who are enrolled in Medicare. And they've been following them since the late 90s. And so here on this slide, you can see there's 3 bars. So this first one is 65 to 74-year-olds, 75 to 84-year-olds, and 85 plus. The African Americans are in purple, and you can see, and the whites are in black. So in every age category, the purple bar is higher. That means there's more people, more African Americans with this disease than whites. The yellow bar, or orange bar, is Hispanic, so they're high as well. And we're trying to figure out why that is. So it seems like this disease is affecting minority communities, African Americans and Hispanics at a greater rate. And so the Alzheimer's Association a few years ago, well, probably more than a few years ago, maybe about 10, put out this press release saying it was a silent epidemic in African American community because we were not really paying attention to it. You know, everything we saw on TV was, you know, President Reagan, you know, white face. So we're like, oh, that doesn't affect us. So they want to raise awareness, you know, and they've been doing it for a while. And so, and you know, you are also partnering with that. So that's really great. This is not just one, it doesn't discriminate, basically. But it looks like it's affecting African Americans more. And we'll talk a little bit about why that is. Okay, so can Alzheimer's disease be prevented? If we don't know what causes it, we don't have a cure, isn't the next best step to prevent it? Like, would you rather, you know, me find a cure and you get to Alzheimer's and I treat it, or would you rather never get it?
Never get it
Never get it
in the first place,
So we
please,
want to see if we can
Jesus.
identify things, you know, that we can do, whether it's physical exercise, mental stimulation, social engagement. What can we do to have an impact on this disease? That's what we focus on at the Alzheimer's Disease Center. And there's 2 kinds of risk factors. A risk factor is just something that increases your risk of getting a disease. So smoking is a risk factor for cancer. It doesn't mean if you smoke, you're definitely going to get it, but your chances are, you know, high that you will, right? Same here. There's risk factors for Alzheimer's. Some are non-modifiable, things you cannot change. Some are modifiable. Now, somebody asked a question about age. Age is one of the non-modifiable risk factors. There's nothing you can do about it. If you get older, your risk is going to increase. The only thing that's going to protect you from getting older is to die. We don't want to die, right?
Not too soon.
Not too soon, right?
Eventually.
So we know that people over the age of 65 have a 5% risk of getting this disease. By the time you reach 85, your risk has increased to 50%. So if you have 2 85-year-olds, one of those people is going to have a chance of getting this disease. So just doing nothing, just getting older. Now, we don't know if it's, physically us getting older, or is it something that's tracking with age that's underlying this disease? That's what we're trying to figure out. So it primarily affects people over the age of 65, but there are other types that I'm going to talk about in a second that can happen younger, okay? So age is one non-modifiable risk factor. Another one is genetics. Now, Alzheimer's is not inherited, like you think about a disease being passed down. There is a type of Alzheimer's that's inherited. It's called autosomal dominant Alzheimer's disease. But this is very rare, and it happens when you have a mutation on one of 3 chromosomes. So if you have one of these mutations, you will definitely get the disease.
Say
There's
it
only
ain't
like
so,
maybe
Lord.
200 families in the U.S. that have this kind of Alzheimer's, and you get it in your 30s, okay? So it's very rare, and most people don't have it. The more common kind is the kind you get after age 65. That's called sporadic Alzheimer's disease. And the only difference between the autosomal dominant and sporadic is when you get it. You get it either in your 30s or you get it after age 65. Now, I have to tell you though, there is a group of people who are starting to get these symptoms in their 50s. And we're not sure why. It's, it's earlier onset, but it's not the mutation type. It's this late onset, but it's happening earlier. So we're trying to figure out why. We actually have a group at Rush called Without Warning. And they've been, there's a support group right now, but we are hoping to start research around that to see why are people getting it a little bit earlier. Okay, so
Thank you.
in the sporadic type, there are genes involved, but they're just susceptibility genes, which means that if you have the gene, your risk is increased. It doesn't mean you're definitely going to get it. So one of the most well-established genes for the sporadic is called the apolipoprotein E. For short, it's the ApoE gene. You might have heard of it, ApoE. And it's a type of protein that carries cholesterol and other lipids in your body. And there's 3 types. There's an E2, an E3, and an E4. You get one from each parent. E3 is the most common. Most of us in this room will have E3, and it's neutral. E2 is protective, and it's very rare. If you have an E2, you have a decreased risk. E4 is the one that increases your risk. So if you have an E4 from one or both parents, you will have a greater chance of getting this disease. Okay? But again, doesn't mean you're definitely going to get it.
I will
Now, the
not
interesting
get
thing
it in
about
Jesus' name.
E4 that I've been looking at, and other people who study African Americans, we know that it's the frequency is about 20% in the general population, and if you have the disease, it's about 40%. But in African Americans, we're more likely to have the E4 gene. Just, for whatever reason, we have 35% of our population will have
They
it.
don't even know the call.
And it's associated with an increased risk in whites, though, not in African Americans. So it's a puzzle. It's like we have more of this bad gene, but it's not doing the same thing in our bodies to affect Alzheimer's. We know that it's a really strong risk factor for whites. Hundreds of studies have shown this. But if you look at African Americans, either it will be not related or it will be much weaker. So there's something else going on with this gene that we need to figure out. It's not just the gene by itself. Now, a recent study came out in 2013, 2 years ago. Yes.
Hi, how do you know you have that?
Well, you'd have to get tested, but we don't do that because it's just a susceptibility gene. It's not going to tell you. You can have the E4 and never get it. So it will be setting up this whole alarm, you have to change your whole life because I have E4 and you might not ever get it. And plus, we don't have any good way to treat Alzheimer's. So until we can actually get some really great treatments, we're probably not going to use that as a diagnostic. So we don't tell people and people don't get tested for it. Yeah. 2 years ago, this study came out in JAMA, which is a high-profile medical journal, where they discovered a new gene in African Americans called the ABCA7 gene. And this study was a genome-wide association study, and it was the largest done in African Americans. Now, we've had many GWAS done in whites because, we have a lot of whites participating in research, so it's easy to do studies with them. But for this study, we had to pull data from 18 centers across the country to get enough African Americans. And Rush was one of the centers that contributed because we have a lot of African Americans in our research. And they found genetic associations on a series of genes on chromosome 19. They found the E4 that we know is a risk factor in whites, but they found this new gene, ABCA7. And this was a different result than they saw in the whites. Now, what does this ABCA7 do? Well, it increases your risk about 2 times if you're African American. And the really interesting thing is that it also is involved with cholesterol transport. Now, what do we know about African Americans and cholesterol?
Hi.
We tend to have high levels of cholesterol, probably because of diet, a little bit of genetics, a little bit of, sedentary behavior. So this suggests if both of these genes, the E4 and this ABCA7, are both important in cholesterol and they're both increasing the risk in African Americans, it suggests a potential target that we can look at. What if we started giving people cholesterol drugs? Is that going to help with the Alzheimer's? We don't know. More research has to be done.
Better eat
This
your
was just one
Cheerios.
study. You never, make firm conclusions off of one study. We have to replicate this study. We have to make sure this gene is true, that it pops out again, and then we have to do more research to see if cholesterol could be a possible pathway. But it's exciting because it's suggesting a new direction for us to look. Yes?
The subjects in the study, did they have, was there a baseline for their cholesterol level?
Oh, that's a great question. They didn't even look at cholesterol in this study because they didn't know, going in. People did not have Alzheimer's. They just looked at the genes to see. Some people had, some didn't, and the genes that popped out were these two. So they don't know. But that's a great question. Yes.
Garbage.
This is about 18 studies going on across the country, and so they told them, send me all of your people in your studies that have Alzheimer's and the ones that don't. And we're gonna do this genome-wide association study and compare the two, the people who have it and the people who don't. It's called a case control study. And the ones who had the disease, they were much more likely to have these two genes. Okay? So a potential target for us. But, we have at Rush and across the country, other investigators as well, we've identified a number of potentially modifiable risk factors. We can't change your age, we can't change your genetics, but there are things that we can change, and that's what we focus on. And so I've listed here all the things we've published and other people have published about things that increase your risk for the disease. So things like stroke, diabetes, hypertension, and you'll notice those first three things are really common in African Americans. But then there's also, loneliness, depressive symptoms. So there's things about your mood that increase your risk. If you're a current smoker, it seems to increase your risk. But then there's a host of things that are protective. So we know people with more years of education tend to have a lower risk of this disease. Now, we don't know what's education doing. Is it something, we're growing more neurons and synapses, or, what's happening? We don't really know, but we know that people with more education tend to have this disease at a lower rate. But look at President Reagan. I mean, he had a lot of education, so it shows you there's just a risk factor.
But he had a lot of stress too.
But then also, cognitive activity, physical activity, social activity, all those things are things that you can actually do. You can change. You can become more cognitively active. You can become more socially active. You can go out there and get on the bike or walk around the block.
Absolutely.
Those things seem to matter in decreasing your risk. So let's go back to our question. How do we prevent Alzheimer's disease? Yes?
I'm sorry, your previous slide mentioned risk to increase as well as decrease, and your earlier slide mentioned the fact that minorities tend to have higher incidence,
Right.
be it Hispanic or African American. Have they really looked at the factor that stress involves, that stress can create this? The fact that you're a minority in America increases your stress.
The stress
which will then
proneness.
increase, I'm just wondering, did they ever look at a correlation between stress?
Yeah.
And having that mindset?
Yeah, I'm going to show you some data that I looked at. It wasn't with Alzheimer's disease, but I looked at something, a stressor that African Americans tend to experience perceived discrimination. And I'm going to show you some data that suggests that it could be in that direction. But, there's a couple problems with us studying minority populations. Number one, we don't have a lot of people participating in studies, because we don't tend to participate in research for really good reasons. It's a really ugly past with medicine and science. But the second thing is that we don't have a lot of people like me doing the research. So if you don't have people like me who come from the community, who, I live as an African American in the U.S., you're not going to ask the same kinds of questions. So those kinds of questions have not been asked to the degree that they should be. So if any of you are going in this field, come join me. I can use some help. But that's a really good question. So if we go back to how we prevent Alzheimer's disease, you identify these risk factors, genetic and lifestyle, that are somehow leading to the disease in some kind of way. But the more important question is, how do we build a healthy brain as we age? Let's focus on that.
Yeah.
What can we do to build our brain so that we don't have to deal with this disease? Well, in order to do that, you need studies, research studies. You need a lot of people who don't have dementia, because once you already have the disease, it's too late to understand what causes it. So in our studies, we have people who don't yet have the disease, And they have to agree to donation of a blood sample so we can test genetics. And they have to agree to detailed assessment of potential risk factors and annual testing, because you want to see people on a regular basis, because you don't know when somebody's going to get the disease.
Okay.
So one of the studies I'm going to talk to you about is called the Minority Aging Research Study. Now we have 5 large studies in the Alzheimer's Disease Center. And let's see, 2 of them, the first 2 are predominantly white. They're really famous. One is called the Religious Order Study, and it consists of older Catholic clergy. And that's been going on for over 20 years. And that study has, we've learned so much from that study. But those people are very homogeneous. They're Catholic clergy. They live, same kind of lifestyle, eat the same kinds of foods. They don't have children. They don't smoke. So it's hard to generalize to a general population. So we have another one that's predominantly white called the Memory and Aging Project, and that's like just in the Illinois area. And so both of those studies are predominantly white, but they require brain donation. So in order to be in that study, you have to say, I'm going to give you my brain. Now, I work with African Americans, and I know that that's not going to happen very easily. I have to really work at it, right? So my study is one that I started in 2004, and it's right now it consists of over 750 African Americans. And all you have to do is identify as being African American, be at least 65 years or older, and not have a dementia diagnosis. And we do annual in-home testing. So we never ask people to come to Rush, because transportation is a barrier for older adults, and also navigating the complex medical system. So we send a research team out to the person's home, and we collect the data and bring it back to Rush. And everyone agrees to that and a blood draw. Now in 2010, after working with the community for several years and gaining trust and really having a partnership, we decided to add brain donation as an optional component that people could endorse if they wanted to. It's not required, and we definitely don't push it on people. We get families involved. And we have so far about 250 people who have agreed to donate their brain when they die. And we've had about a little bit over 50 brains to date. But that's compared to the white studies where they have 2,000 brains. So we're really lagging behind, but you have to start somewhere.
Donating his body to science.
So in this study, because it's focused exclusively on African Americans, we're able to look at a host of social cultural risk factors that have not been looked at with this disease before. So things like perceived discrimination, perceived stress, based on financial or caregiving or whatever you're experiencing. Quality of education. I told you that years of education is a risk factor. So the more years of education you are protected, but it could be quality too, right? Because a lot of African Americans in this age group that we're looking at, they would have been in school in the 20s and 30s. School was segregated. I mean, even more so than it is now, right? It was legally segregated. And a lot of people, grew up in Jim Crow South. So quality of education